Dr. Sahil Sanghavi, a hip and knee joint replacement surgeon at Sancheti Hospital in Pune. Today, we'll be discussing the frequently asked questions about hip replacement. The hip joint is the joint which connects the upper half of your body to your thighs at the waist. So it is a ball and a socket joint. So to explain on a bone model, this is the part of your thigh bone which is called as the femur. And this pink portion that you see that I have highlighted here is the ball, and this is the socket. So this ball and socket join each other at the waist, and that is why we move our legs while walking, while jumping, sitting cross-legged or squatting, and this movement happens at the hip joint which is located at the waist. So when the natural hip joint of the body is damaged, we have to perform an operation called hip replacement. In hip replacement, what we do is we put in a new ball and a socket. So to again explain to you on the bony model, this pink is the new ball which is put in, and similarly this pink cup that you see is the new socket that is put in. So this now functions as an artificial hip joint, which is what we do in hip replacement. The conditions most commonly for which hip replacement operation is done is avascular necrosis of the head of the femur, which is the ball that I showed you, that is known as AVN, where the blood supply to this ball gets damaged. Other common conditions are arthritis, which is wear and tear of the hip joint, and also when patients above the age of 60 have fractures around this hip joint. So these are the common conditions when we do a hip replacement operation. So hip replacement can be of two types. The first one is known as total hip replacement, and the second one is known as partial hip replacement. In total hip replacement, the ball and the socket both are changed. That is, the ball and the socket, both the components are changed. It is known as a total hip replacement. And in partial hip replacement, only the ball is changed and the natural socket is left behind. So these are the two commonly done types of hip replacement surgery. The most commonly used implants for total hip replacement are of two types in today's day and age. One is known as COC, that is ceramic on ceramic, and the other one is known as COP, that is ceramic on polyethylene. So in these two types of implants that are used, the head or the ball is made up of ceramic, whereas the socket may be of ceramic or of polyethylene. So the hospital stay for total hip replacement or partial hip replacement, to explain to you in simple words, for example, your surgery is planned on Monday morning. You get admitted on Sunday. The surgery is done on Monday morning. 24 hours after the operation, the patient is kept for monitoring in the ICU. After that, for example, on Tuesday morning, the patient is then shifted back to the room, and we begin with physiotherapy, exercises, and the patient is made to walk with the help of a walking frame or a walker support. So once the patient starts walking comfortably after the operation, the wound is clean and there are no other health related issues. On the third or the fourth day after the operation, we discharge the patient. So after discharge, the stitches are usually removed at about 2 weeks or even in some cases up to 3 weeks. Physiotherapy can be continued at home and exercises are usually done twice a day. For about 4 weeks after the operation, the patient is advised to walk with a walker support, after which for another 2 weeks they can use a stick or a cane. So about 6 weeks after the operation, the patient can walk without any support. After hip replacement, there are certain activities you must avoid. There are 3 main activities which should not be done after hip replacement surgery. The first one is you must avoid sitting cross-legged. Secondly, do not squat or use an Indian toilet. And thirdly, you must avoid any floor activities such as sitting or sleeping on the floor. These activities should usually be avoided lifelong after total hip replacement. So hip replacement has a success rate of 95 to 99%, and in fact it is so beneficial for patients that it has been known as the operation of the century. Certain complications can also arise after hip replacement. These include dislocation. So in dislocation, what can happen is this ball can slip out of the socket, and that is known as dislocation. Other complications that can happen are foot drop or sciatic nerve palsy, in which the power of your ankle and foot muscles may become weak. Thirdly, the complication of infection can happen after any operation, and that depends on various factors such as the patient's own immunity as well. Thank you.